Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello and welcome back to this episode of Podcast. My name's Fern and I'm really pleased to be joined again with Natalie Bradley. Hi Natalie.
Hi Fern.
And we're just going to delve a bit deeper really into the challenges for young dentists at the minute. So obviously you're a young dentist yourself, you're the chair of the Young Dentist Committee. So just to start with, if you just want to introduce yourself to the listeners and just remind us, what you do.
So I'm a consultant in special care dentistry. I'm a clinical director for Dentaid, the dental charity, and the chair for the British Dental Association's Young Dentist Committee. Brilliant. So yeah, not that mouthful, isn't it?
So for any aspiring young dentist then, what steps would you recommend to prepare for the demands of the profession?
Oh, that's a really good question. I think it's really important for young dentists to be informed about the information that they're getting from different places about the profession itself. What I mean by that directly is probably just being a bit aware of what they see on social media, because I know we take a lot of things by what we see on social media now, but there's only one skewed view of what the profession might be like. You also don't know what that person's posting is valid or not, or how genuine it is. I mean, there's lots of really good things about social media in terms of the share of information is easier, to share a bit of information about something as it ever has been. But I think that it's nothing really does replace also then going out and talking to people and meeting people, and from different aspects of the profession as well, because everyone have a different view of different things within dentistry. I remember when I first qualified thinking, I wanted to go one particular route. I was going to work in practice, or maybe I was going to get involved in teaching, and I was very, sure-minded of that. And actually then I thought, I'll do a year doing something else and see what it's like. And then that completely changed my perception of things. So it's making sure you're challenging your preconceptions about things, and it's never too late to actually reassess what's right for you at what stage in your career, and not to disregard something because you heard someone say, our practice is like this, NHS practice is like that, or working at hospitals like this, because actually you don't know what something's like until you try it yourself, and you never know actually whether that should be the right thing for you to do at that point. Depending on what you're interested in and what you're good at as well. Yeah,
that's a really interesting point actually, because do you think there is sort of this misconception that you graduate and then you go into NHS practice and like a set sort of path, and you're saying that's not the case?
Yeah, I think everyone's individual and everyone's different, and it's hard to know what your path would be, because you can't see into the future, but you might have a conception because every year of dental school you'll be like, okay, so first year we do this, second year we do this, third, and you've been doing that for 5 years. So then, another year of foundation training, yeah, fine. Then maybe a year or two of NHS and then going private. And that's what generally a lot of, I would say a large percentage of dentists coming out of dental school think their career is going to end up, but you actually don't have to always think like that. That might be the right path for you. Bear in mind that a lot of people do that, but there's also different things that you can try, different settings you can try a non-clinical job, you could do part-time dentistry, part-time something else. Everyone's different, and it's just finding your why and what makes you tick and get out of bed in the morning, and you can diversify what you're doing. It's not saying I'm a general dentist and that's all I do, but actually you can be a general dentist and also do facial aesthetics. You can be a general dentist and also work in hospital. You can do a non-clinical job and also be a clinical dentist. Like, there's lots of things that you can mix up a career, and I think there's a bit of a lack of awareness maybe that dentistry is a broad scope career. Everyone thinks when they go into dental school, when they graduate, they're probably going to be what their dentist or their orthodontist was like, because that's what they're aware of, but there's so many other things that you can do.
Yeah, no, that's really good to hear. I think that, or just to maybe think outside the box with different possibilities and things, that it's not, set. Obviously there's a lot of challenges for dentists in general, but are there any specific ones that young dentists face, and do you have any advice on how to overcome them?
I think a real big one at the moment is not knowing what the future of NHS dentistry is going to look like. And I wish I had some advice to say this is what this is what NHS dentistry is going to look like when you graduate or in a few years. But I I don't really, because we just don't know. I remember when I graduated, they said, oh, don't worry about this NHS contract. They're reforming it. By the time you finish your foundation year, it'll be a completely different contract. And here we are 10 years later with the same thing. And I know morale is low because of that, and all we hear about is the broken NHS system and the access crisis, which is really demoralising as someone just coming into the profession. And also, if you're doing NHS work earlier in your career, it puts a lot of pressure on you as an individual, because then I'm going to leave the NHS, or there's so many patients coming in with so much treatments. It's quite hard not to get burnt out. So I think in terms of that remit is making sure you have good support around you, and make sure you have breaks. Don't take the world on your shoulders. Don't be a hero, because do the best you can for your patients, but ultimately you need to make sure that you don't get burnt out within the first year or two of graduating. If you want to stay in dentistry, it needs to be sustainable, and you need to make sure that you're realistic about what you can provide. And yes, you can feed into trying to make change happen, but change takes time. People are top ends of big organisations like the NHS and BDA and campaigning for change for 10 since the contract came into place in 2006, and we still haven't changed it really. So it can be really frustrating, but not to be so disheartened by that, and just try and take in each individual patient as they come.
Brilliant. It's really good advice. And you sort of covered it before with the different career paths, but how do you envision the future of dentistry evolving for young dentists sort of entering the profession then?
I think there's going to be a change in how younger dentists work pattern works. People don't want necessarily to work 9 to 5 Monday to Friday anymore in one place. They might do a couple of days here or there. They might have their own business doing something else on the side. They might work 3 days a week and that's all they need to do, which is absolutely fine. And I think it's just, if that's the way it's going to go, it's balancing this portfolio career so that you're dedicating enough time to stuff that you are doing. And I personally find that quite a challenge sometimes with all the roles that I have. And I've come to realise that over the time that actually, just because you do more roles doesn't mean that you're a better person. It's like you need to dedicate enough time for each of the roles that you have, otherwise you're going to do a bad job at something. So dedicating enough time for whatever you're doing at that moment, trying to be good with your boundaries, which I think maybe younger people might be a bit better with, but I don't know, because we're all on call 24/7, because you can pick up your smartphone and check your emails first thing in the morning and last thing at night, which I'm probably guilty of doing too often. But having your boundaries so you know, this is the day I'm working at this place, this is the day I'm doing this, and after that I'm switching off, which is really important for your mental health, really, because it's blurring your boundaries of work-life balance. If you're just constantly on call, constantly working, your mind can't rest and you can't switch off. It's
so important to have that different set times for work-life balance. And actually that was my next question. It's always like you're one question ahead of me. I was going to ask, what advice would you give to young dentists regarding building a successful career and maintaining that work-life balance?
Yeah, I think the boundaries thing is really important for the work-life balance, and then knowing when you're switching off, like you're not going, that is time when you're not going to pick up your phone and look at the emails, or if someone's going to call you, just don't answer. Put your out of office on. I think that's really important, and making sure you take enough breaks is probably something I'd recommend. I think my first year I collated all my annual leave and left to the end of the year, and then I was just knackered. Like you do have annual leave for a reason, or you need breaks for a reason, so make sure you take sufficient breaks. I think probably the best career advice I would give, or what I feel would be the best career advice I could give people coming out earlier in their career, is really finding people who share the same values as you, and then keeping in touch with them as mentors, and people who have the same values as you won't mind if you drop them a message every so often again to say, oh, how are you doing? I've got this situation, how would you deal with it? Can we have a coffee? Things like that. I think if and finding the people who you connect with is really important, and keeping them in touch. My foundation trainer, when I did my first year as a dentist 10 years ago, I still can't drop him a message every so often, go visit him. If I need an emergency reference, he's always there as well. So, and then go to personal life events with each other and things like that. So it's that's when you'll feel fulfillment, and actually they'll help you throughout the career. Even if you go down a completely different route to what they've done, they will be able to share advice, or put you in touch with the people that they know. So I think it's just finding those people, finding your crowd.
Yeah, definitely. And you mentioned mentoring there. Is that something you're like passionate about, or?
Yeah, I think it's really important to support. I mean, if you go, I'm a bit of a stickler for if something didn't go well for me, or I hear something that didn't go well for someone I'm close with, like I want to do something about it. And it really infuriates me when you see someone probably quite early on in their career and they've had a bad experience with a certain, someone supervising them or another dentist, and that really affects you when you're early on in your career because you don't have much experience. So how many people I've trained in my hospital job now who come through and go, I chose to do a hospital training job because I hated practice. And you go, what did you happen in practice? I had a really bad foundation trainer, and that's tainted their whole career of dental practice for them. When actually it's not about might not necessarily be about dental practice. It's that one interaction in that specific practice that has put them off. And actually, if you find the right practice for you and the right mentors, actually you could probably really flourish in the right environment. So I think that mentorship and helping support people is really important, and making things better for the next generation. Like I went through quite a rigorous process to get to my consultant's post job right now, and I do remember some people well, you have to do this to be able to be a consultant. I'm like, well, actually, do I have to be worked 40 odd hours a week and let you speak to me in that way, but just because you're a consultant I'm a trainee? Like, surely if you had been in that situation, you'd want to actually treat that person better, so you'd have the better experience. So I'm very mouthy about that.
Oh, brilliant. And so just finally then, we've been talking a lot about technology and the future at Dentistry Show, and just wondering, do you see technology impacting the future of dental practices, and how do you suggest young dentists can sort of leverage this in their career?
I think there's lots of things that we can do remotely now that would be really, really good. So you don't physically have to be in your dental practice maybe every day of the week. You can do remote. I do a remote consultation clinic as part of my job once a month, which is really handy for certain patients. And actually that technology really benefits certain people. It's also handy for your own work-life balance. If you don't have to physically go to work on that day of the week, like you can do that from home, or you can do that in a location that's closer to you. Same with things like dental technology, accessing them remotely from home. But then, of course, you come back to that boundary setting thing in terms of if you can check your patient notes and your patient list at 12 o'clock the night before, should you really do that? So it's just being a little bit careful. And also being responsible, because with technology advances, it's all very exciting, but we don't necessarily know how some things might be misused, like with the advances of AI, and it's all very exciting that we can use that, but we don't know what may necessarily go when things go wrong, how it's gonna. So just being aware of that, and things like confidentially sharing information, making sure that everything's tip top that way as well.
Brilliant. That's a really, really good point actually about the benefits, the being remote and whatnot. So brilliant. Just to end with then, any final advice for any young dentists, who's sort of preparing to go into the world of dentistry? Do you have any final words?
I think just be positive. Like it's quite easy to feel a bit doom and gloom about things, especially if you talk to certain people. But it's a really fulfilling career, and I just think that actually the difference you can make for individual people should never be forgotten. We get very caught up in focus and the nitty gritty of I am doing this treatment for this patient, but actually don't forget what that treatment means to that person. If you get them out of pain, how grateful that person would be. If you fix their front tooth and make them be able to smile again, like that's the things that should get you out of bed in the morning. Not like, I'm going to do a composite this morning, so I'm going to make someone be able to smile again. And that's the things that we should be valuing as a profession. Never forget.
Oh yeah, no, brilliant. That's lovely. Thank you so much for joining us again, and hopefully you catch up again soon.
Thanks.